Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I'm your host, Reinier Schuur, and joining me today again is Dr. Colleen Smith. Welcome back to the show, Colleen.
Thank you for having me on again, Ray. I'm excited to be here.
So this is the first of a series of episodes that we wanted to do on certain topics in healthcare and health policy. But one thing that I noticed when trying to think of what topic to start with, given how complex American healthcare is that any one of these topics operates in a debate that is totally different from the way that I think about these topics. So the idea that we had for the first series of episodes is to contend with the healthcare debates and try to rethink healthcare entirely. So that's what we're going to do for the first few episodes. And for this episodes, we're going to give a basic roadmap of how we think about the healthcare debate and how we think we should rethink it. So one way that the healthcare debate is often framed, especially from people who claim themselves to be for free markets, is that well, we already kind of agree on what the values at stake are. We want affordable healthcare. We want everyone to have access to it. And the whole debate is really just a kind of technical debate about, well, how do we get there, right? That is certainly not our perspective. And while it's true that there's many values in healthcare that people appear to agree about, such as, for example, that healthcare is affordable, that you have meaningful relationships with your doctor and other people in the healthcare system, that there's trust. A lot of these concepts can be taken out of a wider framework. And you see that in other policy areas as well. Like in foreign policy, people might say, everyone wants peace. But is that really true? A lot of these concepts like peace and freedom mean something in a wider philosophical framework. And you can have real disagreements on what those things mean. And from my perspective, it is certainly not the case that the healthcare debate is simply a technical debate. It is a debate about how these concrete values of affordability, of efficiency and trust are embedded in a wider framework. And it's that framework that people seem to be disagreeing about. And if anything, it is people who are either against free markets or for a heavily regulated market who are the only ones who are really offering a positive alternative. Because they are using concepts such as, well, we want justice in the healthcare system. We want equality. We want fairness. And then their conception of what that means is very different from what it would mean to have a healthcare system that's based on trade, on profit, on sharing value for value, on, in some cases, inequality. Because if you make more money and you are willing to spend more money on certain goods, it means that some people will have different things.
Yeah, I think, Ray, those are all really good points. You point out this one version of the healthcare debate that many people have, which is how do we pay for healthcare for everyone, right? Because everyone wants affordable healthcare, and that's our goal. And so that, from many people, comes across as, well, really, how much should the government be involved? And I think in most of these cases, there's also this underlying assumption that healthcare and the same healthcare for everyone is a right that everyone has. You mentioned that in some cases, healthcare won't be equal. There won't be equality in healthcare. And like, that's okay, maybe, right? Because some people might be willing to pay more or less for healthcare. Some people might want to engage with the healthcare system more or less. And I think if we, as AFCAM, engage with the healthcare debate on this level of healthcare needs to be just because it's a right for everyone to have healthcare, and therefore, how much should the government be involved in order to make sure that everyone has healthcare? Or maybe the debate is healthcare is about we all deserve healthcare. Healthcare needs to be more affordable, and that will fix everyone's access to healthcare. And so, how much should the government be involved or not involved in order for healthcare to be more affordable? And in all of these cases, there's no question of what about the freedom of people and physicians and doctors and nurses and everyone on either side of the healthcare system to make choices that are right for them. And regardless of how this debate is framed in this main way that most people tend to look at it, we're taking away the ability for anyone to make a choice from the side of the workers in the healthcare system, as well as from the side of the patient. And so we're really ultimately creating a system and debating a system that doesn't serve anyone, that actually is a system where we're just trying to decide how much force do we put on all the various players, which is everyone, because we all interact with the healthcare system in some way. Whereas really we should be saying, how do we free everyone up to do the thing that is right for them?
I think it's telling that people who claim to be for free markets in healthcare, it's actually not at all clear what they stand for, fundamentally. And you see that in a way throughout the history of American healthcare. Originally, the AMA was against Medicare. We're saying it's socialized medicine, which it is. And then slowly but surely, the goalposts keep changing, right? For people who claim to be for free markets in healthcare. Then next you have compassionate conservatism passes Medicare Part D, the largest expansion of the Medicare program. Then you have Romney Care, which is the basis for the Affordable Care Act on Obamacare. And now there are people who maybe 10, 20 years ago were really critical of Obamacare. Now they just say like, well, this is the system that we have to operate in. And then it raises the question of what alternative is actually being provided. And it's really only being provided from one side, which is incrementally more government control, which means more control of the choices for patients, doctors, insurers, pharmaceutical company. And what that does create, what you pointed out, is tension in our relationships, which then creates this looping effect where people feel like they're in this situation that they don't want to be in, that they're not in relationships where they feel good, that they feel under pressure.
They're not in relationships where they feel valued,
That's
either,
right.
right? Neither patients nor doctors.
And then the only avenue that they are presented and that they can even think of is, well, the reason why the insurer is beating down on me or whatever the relationship is, I need to get the government to control them, right? And each and every one in the system is doing that to each other. That's a crucial problem that not only is there no positive alternative, the only alternative that's being provided is how can we control another group, as opposed to seeing the value in freedom, not just for yourself, but for other people to have better relationships.
Well, I think it's interesting that you said that many of these groups, the way that they approach things, it's telling that they have some contradiction in their approach, right? And I think the AMA, which you mentioned, is a really great example of that because early on in the 1900s, they were against many moves to socialize, quote unquote, medicine. They were against single payer options, even for veterans and a variety of things. But then when doctors began to create conglomerates together, conglomerate systems where they would work together and patients could pay a fee to be seen by a group that included specialists. Doctors were beginning to create their own private model of healthcare that patients could buy into. But because it was different than the single doctor, single patient relationship that had persisted for 20 or 50 years preceding that, the AMA also came out against doctors who were willing to participate in these voluntary organizations that they created on the free market system to make healthcare more affordable for patients. So, the AMA on the one hand is against socialized medicine, but also has come out in many cases to be against free market movements in medicine as well. And I think that really points to the AMA is not about freedom. Like the debate for them has never been a question of doctors and patients together deciding what's best for them and having the freedom to work together. And I think this is also an example of using force against their own doctors in order to try to game the system. And ultimately, whenever that happens, they end up whether it's the AMA doing it or the government doing it, we end up with incentives that are not incentivizing what we wanted to incentivize. It makes me think of the line from The Princess Bride. You keep saying that word. I don't think it means what you think it means. Like you keep making these regulations. I don't think they do what you think they do. And I think we have long history of seeing a problem in medicine and slapping it with some sort of band-aid type of regulation or change without really thinking about not just what do we want, affordable medicine, but really what is the value of medicine? And the value is not necessarily that medicine is affordable, that your access to medical care is affordable. For example, it's that as a patient, you're free to engage with a doctor, and as a doctor, you're free to engage with a patient in a way that provides value to both of you. And, maybe that value is money, but the value also, as we mentioned, is a relationship, is getting satisfaction out of helping someone feel better and, live their life better, is not being sick anymore. There are a lot of value here. But if we just focus on each of these outcomes, we're missing the core, which is the freedom to interact and exchange.
I think, again, it's telling that when doctors or even patients or really anyone in the current system complains about it, but especially on the side of the providers, they'll complain about it in terms of it's inefficient, it's paperwork, but those are all in terms of a negative. And I think part of the problem is that they don't actually have the language to
Mm.
express the values that got them into medicine and that would actually not only want to make them stay because, well, they invested so much now they have to see it through to the end, but help them thrive is, well, sure, we want a more efficient system. We want a meaningful system. We want a moral system where we can have relationships not only based on trust, but mutual respect. And you hear that all the time, that like everyone that in healthcare system feels disrespected. And there's definitely some truth to that. But then it should raise the question of where does that disrespect come from? And I think in large part it comes from the fact that we're put in these situations not of our own choosing, not of our own making, which makes us resent not only the system we operate under, but each other. And that is a real shame.
Yeah, I mean, I think that's really naming one of the major issues with medicine and really one of the reasons why patients are so unsatisfied, but also why doctors are experiencing this thing, this like burnout or moral injury. And I think you're absolutely right. There are a lot of reasons why maybe doctors are experiencing moral injury and burnout, but I think one of the major ones, and what we don't always have words for, is that the way that the system is set up basically pits doctors against patients and even pits doctors against insurance companies and pits doctors against each other. And we're in this situation where we honestly almost have to lie, like in order to do the right thing for our patient. But now, as a doctor, I'm a liar. It doesn't happen a ton to me because I'm in emergency medicine. And so, kind of just the way things are set up, when a patient comes to me, it's considered an emergency, and I just do the test that I think is appropriate. But I think there are real examples where this comes up all the time. For example, like with medications, there's a cholesterol medication that is new and is definitely better for a subset of patients who have a particular apolipoprotein gene. But the medication is FDA approved, but it's only really covered by health insurance companies for patients who have failed statins, which are the common cholesterol medication that everyone takes. So, in order to get this medication for that subset of patients who have the apolipoprotein gene, doctors and patients are now lying and saying that they're having symptoms from the statins that they're not having because otherwise they can't get the medication covered by health insurance. And, for a variety of reasons, it's also extraordinarily expensive. Many of those reasons having to do with it should be expensive because it's a new, amazing drug, and many of them having to do with the difficulty that it takes to get the drug approved, which is a topic I think for another one of these podcasts. But, like it, even if you know that your lie or your fudging of the truth is for good reason, having to do that over and over again as a doctor or a patient, it takes a toll on you. It isn't what anyone got into medicine to do.
I want to go back to a point that you made earlier about the AMA fighting socialized medicine and this kind of unknown history that they also went after burgeoning business models, alternative financing for healthcare. It points to another great myth in the healthcare debate. The first one that I mentioned is that, well, we all agree about the same values. It's just how do we get there? That's not true. There are fundamental values where people disagree. But this other myth is not simply the fact that, oh, well, people are just ignorant about free markets. We just have to educate them. There's also this myth that we had a free market in the past, and that's what we want to go back to. Our perspective is that there were times in the past that there was more freedom in healthcare, but it was not a free market. And so what we are advocating for is not going back to some known past, but to move forward to an unknown ideal of a real free market. And that is why looking at the history is relevant, because you saw these missed opportunities where things could have been different, where there were alternative funding models that worked for doctors that patients liked, but that the AMA nevertheless went after. Now, the kind of simplistic way you can say that they went after it is that, well, it went against their self-interest in some rudimentary monetary sense. But that's just too simplistic. You can't really understand what happened there with understanding the fact that the burgeoning origins of modern medicine was in many ways driven by self-perceptions on what the profession of medicine is. And the way that a lot of doctors saw the profession of medicine is not as a business. Maybe a business in terms of a solo practitioner, right? Where you can hang up your shingle and have your own one-person enterprise. But if you read the proceedings and meeting notes of the AMA in the early 20th century, they were railing against the commercialization of medicine. And they were railing against the very notion that one doctor could make a profit off of the labor of another doctor. For them, that was inconceivable because that would turn medicine truly into a business. Yet you did have these models where doctors did that and they were able to achieve economies of scale, specialization, division of labor that saved money for patients, that allowed doctors to pursue the treatment that they felt best benefited the health of their patients because it led to better profits for them because profits and the health of the patient were actually aligned. And it's that model that got attacked. Now, who knows what models would have developed afterwards and could still develop in the future. The bottom line is that we don't know, and that's part of the beauty of markets, is that we have to conceive of new things, new models, new ways of doing things. And that's precisely what we can't do now in healthcare. We are in many ways ossified in this system that we have, where we're very limited in our options. And we're just tweaking things here and tweaking things there. And that just completely blinds us to the actual possibilities that are before us. But in order to see those possibilities, we have to question some of our fundamental assumptions about this debate. One of them being, what is the nature of the profession of medicine? And how do we want to see ourselves in our role as patients?
Yeah, I think that's a really good point. But I also think one of the reasons why we need to think about this as a forward-looking movement where we're trying to imagine what could be rather than what is because there's also this sense of the history of medicine in the US not only being like both a free market, which it never was, but also being a little bit of like the Wild West, right? With quacks running around selling miracle cures that were made out of tincture of opium and mercury and whatever, cow dung, who knows. I think we really need to be clear both that that's not what we're talking about going back to at all. And also, I think that maybe didn't exist to the extent that we sort of imagined that it did, although there certainly were quacks in the distant past of medicine in this country. But I think also we're in a time when we can look at medicine and say that there are people who more or less rely on medical science now just as much as there were then. But I think it's as we've seen, and as we are seeing every day, it shouldn't necessarily be up to the government to tell us what medical science is good or not. And I think it's so important for us to really focus on if we can just get out of our way, if we can relax some of these regulations and some of these examples of force that are really skewing incentives in medicine and incentivizing, again, doctors and patients to lie and incentivizing doctors and patients to be in conflict with each other, we really could see so many new things come out of that relationship. And so I think it's so important for us to, as we go through these podcasts and talk about different topics, to think about the debate about healthcare to be really more coming down to the question of what steps would lead to more freedom? What steps would lead to more choice? What steps would allow doctors and patients or the healthcare system and patients to interact with each other in a respectful way where they're exchanging value? And that value means money. It means supply and demand, but it also means honesty and people working together toward goals.
Yeah, I think that's totally right. And to put a finer point on that, what we are advocating for when we're advocating for free choice in medicine is not necessarily the freedom to do whatever you want, take whatever medication or drugs you want, experiment on yourself. Although you should have that freedom. You should have the freedom to make bad choices. But really, our advocacy for free choice in medicine is the free choice to trade freely with other producers of value, other experts of any kind, whether they're experts in health or in different ways of financing health or developing drugs. But the only way to actually pursue those rational values is to have the freedom to actually do it. And I mean, we may have our criticisms of the AMA, and we'll get into those in later episodes. But one thing that the AMA did do, which was valuable, was to clearly distinguish between scientifically informed medicine and quackery. Now, sometimes they use the term quackery as a cudgel to attack something that they didn't like. So they even called doctors that had a patent on a drug as practicing quackery. So the term was abused. But it is certainly true that they recognized that the way that the profession would mature would be to embrace science. And that's also what made it a profitable endeavor. And that was done not through the government, that was done privately and voluntarily. And we will spend future episodes examining more closely not only the history of the AMA, but this whole question of how to view the profession of medicine. And what you will see there is how not having a positive alternative and essentially conceding the whole idea that force is appropriate in medicine means that you can't fight socialized medicine. And that's why we're in the situation that we are in today, is because of the failure of the AMA, not just as a advocacy organization, but as an organization tasked with the responsibility of thinking about what the profession of medicine actually is. And that's where you would have to actually rethink and challenge your fundamental assumptions.
Well, I think it's not just the failure of the AMA, it's also, I think, the failure of doctors to have the words and the understanding to be able to say that what we're doing has value and we deserve to be recompensed for the work that we do. And whether that's in cash or relationship or kind, there are a variety of ways to get recompensed, but it's not. We deserve that and we should get that. And when I say doctors, it's sort of a stand-in for me for also insurance companies and the medical establishment in general. And similarly, it's been a failure of patients to understand that they're asking for skill and knowledge, and that value is worth paying for. Also, that they're doing themselves a disservice. Well, I guess this is also a little bit of a topic for a future session too, but I think the more medicine has become the purview of the government and government is paying for more and more of it and regulations are paying for more and more of it, it's really gotten worse for patients. There's been a failure to recognize that in giving up their freedom to make choices, they're giving the power of making their own choices for their life over to the government.
I think that points to a deeper issue. The way that a lot of these government interventions into the healthcare system have been sold to the American people is as a preservation of their freedom. It's that we will free you from want and disease. We will free you from the greed of doctors and the pharmaceutical industry. We will free you, right? And so it's again this notion that, well, people agree about the values, it's just how we get there. Like, no, this shows that that's not true. And what people would need is an alternative framework on how to conceive their freedom. And then they can see all the ways in which their freedom is impeded, in ways that they don't even know, and then in ways that they can start defending what's rightfully theirs.
Yeah, I mean, I think a lot of times it's easy to be complacent because most of the time, most people are kind of average, like everything's sort of average. And so if the care that you're getting is average and your needs are sort of average, then people don't always recognize the degree to which their freedom is impeded. And I think that's true both from the patient perspective and the medical establishment perspective, the perspective of doctors and drug companies. It's impeded everywhere, but it really begins to be obvious at the edges where there are more questions, where it's not as clear what should be done, where something newer or more experimental or more creative needs to be done for someone. And then both doctors and patients begin to realize, oh, I had less control than I thought. And I think when you sort of think about the way that the untruths are sort of baked into everything, the way that patients feel often that they need to spin their story a little bit to get what they need, and doctors feel often that they need to spin the story a little bit to get what they need for their patients. I think that's become just par for the course, just what you do, status quo. And it's only in a sort of build up over time that you begin to realize what a toll it's taking on you in either case. To never be able to present yourself as yourself, right? Like imagine you're in a relationship with someone, with your significant other, your spouse or fiance or a partner, and you always have to slightly change who you are or be slightly disingenuous. You're never going to be as close as you could be. That relationship will never be as fulfilling as it could have been.
But I think you're right that most people will not notice those things, that they're doing that. And it's for that reason that you would really want to focus on people who actually want something better, people who recognize that there's something wrong, want something better, whether they're patients or they're doctors. And you can show that in areas where if something new is created, then it becomes clear the controls that are in the way. And like one example of this is something like Uber, right? So Uber would go into a city knowing that they're flouting like the taxi licensing laws, and those laws were always there. People didn't realize how those licensing laws was impeding a new technology. And as soon as people liked the new product and service and it was being threatened, people were like, hey, no, like we don't want these things.
Yeah.
So that's what you would want to do is to attract the Ubers
Yeah.
of doctors and patients and even insurers, people who think that the way that insurers finance healthcare right now is ridiculous, which it is. And
Another topic
like,
to talk about
uh,
later.
yeah, and thinking like, no, we can have a much better relationship between doctors, insurers, pharmaceutical industry, and patients.
Well, I mean, to take your Uber example a little bit further, I mean, I live in New York City, and when I first moved here, there was no Uber, and it was almost impossible. You really couldn't get a taxi in any of the outer boroughs. You always had to call a car service or hail a car service, negotiate a rate. Sometimes they wouldn't want to come to get you, depending on where you were. Like, it was not easy to get a taxi if you were in South Brooklyn or the Bronx. The taxis were really mostly only operating in Manhattan. And Uber changed everything. And then the taxi service really tried to get Uber shut down. They really tried. But ultimately, they failed. And what has happened is that the taxis have had to get better in order to compete. They've had to develop their own apps. They've had to begin to take credit cards. They had to start the new green taxi line, which is like a taxi service for outside of Manhattan. And now it's so much easier to get a taxi everywhere in Manhattan. And I think, although I'm not sure, but I think things are a little bit better for taxi drivers as well as for Uber drivers. And things are definitely better for all the people in the city who take taxis. And it's really that competition that pushed the taxi commission to make changes to make themselves better because they needed to do that in order to compete. And that's what competition does. And that could happen in medicine in ways that, when I came to New York City, I never imagined that it would be so easy for me to get a taxi no matter where I was, or a car service no matter where I was. The idea of Uber and the way that the taxi commission and taxi cabs have changed, that has just made my life so much easier. I couldn't have even imagined it. And similarly, I think the way that medicine could change if we just opened it up to competition. I mean, I could come up with some ideas, but probably it will be things that are just completely beyond my imagination. And it could just be so much better.
There's also another aspect of how we think about the healthcare debate in America, which I think needs to be challenged. And it's this notion, this myth that American healthcare is fundamentally different than healthcare in other countries. And in particular, this whole idea that American healthcare is a free market, which we've already challenged. That this notion that there was a free market in healthcare in the past is wrong. But you see this also when people talk about American healthcare to that of other countries. And again, that's just not true. There's all sorts of ways in which healthcare in other countries, in some cases, is even more free than in America.
Even in the UK, which has a national health service and national health care for everyone, doctors are able to work outside of that system in a free market system that operates alongside but completely independently of the NHS, right?
That's right. And American doctors are prohibited from doing that under the rules of Medicare. And so I think that's very important to take into consideration because this whole comparison between countries is just completely unhelpful. Now, there is one way in which American healthcare is different from other countries, and that is the extent to which it's such a patchwork. It's such a mess. It's regulation upon regulation, framework upon framework. And in that sense, um, healthcare in other countries is more comprehensive in the sense that the policy is comprehensive, which then in some ironic cases leads to the fact that countries with ostensibly universal or socialized medicine might end up in some cases having some areas of healthcare that are more free market than in America. So, for example, in Germany, there's a public option which covers basic healthcare, but the supplementary health insurance market is much less regulated than American health insurance. And so that again is one of these cases where we should fundamentally rethink how we think about the whole healthcare debate.
Right. And the degree to which the public and private system, if there is a private system at all in the US, the degree to which they're intertwined has a really significant impact on the way that healthcare is provided in this country.
That's right. So I think we can take a step back now and look at what we're trying to do here in this episode and the episodes that follow. So the whole reason why it is worth rethinking the healthcare debate is because health is a value. Health is a value to patients, and health is a value as a good that others produce. Doctors, the people who finance it, insurers, the pharmaceutical industry. And for that reason, there are real values at stake that are worth fighting for. But the pursuit of those values are only possible under a certain system. Now, our perspective is that system is capitalism, it requires freedom. And what we would want to do for upcoming episodes is showing the ways in which controls and force prevent us from achieving those values and how to rethink how we can understand and advocate for an alternative system that's compatible with freedom.
Yeah, I think that's exactly what we want to do is really show and maybe get into a little bit the nitty-gritty of some of the various topics that we've really just touched on and moved on here, such as rethinking the moral nature of the profession of medicine and like maybe really giving doctors words. Again, I'm using doctors as a stand-in for medical professionals in general, but giving the medical profession words for the moral nature of medicine and what they're doing and what value they get out of providing this type of service, right? Or other things we could talk about are rethinking what it means to be a patient. Or we also talked a little bit about Medicare and Medicaid and the financing of healthcare. There are a lot of ways in which there are some movements to try to interface differently in a more free way with the healthcare system in the US, both from patients and doctors. And I think it'd be really interesting to compare that with what the kind of status quo with the patchwork government Medicare Medicaid system. Yeah, so I think there are a lot of topics that we can address going forward to help us think about what is currently going on and in what ways could that be more free and what might that look like again, keeping in mind that we really can't know what it might look like because we have never seen anything like a free market of medicine before. But one can dream, right?
That's right. And what we can do is point to cases where there is limited freedom in the current system and how that generates value right now. Right. So we're not just fighting for some pie in the sky in the future, which I know is not what you're suggesting, but we're fighting for values now and in the future,
Yeah,
real values that require freedom.
definitely. Well,
And
thank you so much for inviting me to have this conversation. It's been very interesting.
thank you, Colleen, and thank you for joining us, and thank you to our audience. We'll see you next time. To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.